Hello and good afternoon friends, welcome to the CEC-UGC live lecture. Dear friends, with last lecture in series on medical diagnostics, today we would be talking on cancer. This is the topic for today's discussion, and for this discussion we have once again with us in our studios Dr. Hardeep Kaur. Dr. Hardeep Kaur is Assistant Professor in Department of Zoology, Ramjas College, University of Delhi. So let's welcome Dr. Hardeep Kaur and let's take the lecture forward. Hello ma'am, welcome to the lecture.
Thank you Gitika. So dear viewers, today we are dealing with a very important topic, cancer, a most dreadful disease. Now this is the last lecture in the series of medical diagnostic lectures, and cancer, as you know, is everybody is scared of it. So what exactly is cancer? Let's understand what cancer is. So if you want to define cancer, so cancer is the rapid creation of abnormal cells that grow beyond their usual boundaries and which can then invade adjoining parts of the body and spread to other organs. Now this process is referred to as metastasis. Metastases are the major cause of death from cancer. Now this particular definition has been taken from World Health Organization site, and now let us understand the history of cancer. It goes beyond 3000 BC. The oldest description of cancer, although this word was not used at that time, was discovered in Egypt, and it dates back to, as I just said, around 3000 BC. It's called the Edwin Smith Papyrus and is a copy of part of an ancient Egyptian textbook on trauma surgery, which actually deals about or describes what cancer actually is. Now in 460 to 370 BC, the origin of word cancer is credited to Greek physician Hippocrates, who is considered the father of medicine. Now Hippocrates used this term carcinos or carcinoma to describe either the non-ulcer forming cancer or the ulcer forming tumors. So he gave two terms, that is carcinos or carcinoma. Whatever was non-ulcer forming was called carcinos, and what was ulcer forming tumor was called carcinoma. Now later a Roman physician called Celsus, and he translated the Greek term into the word cancer, which in Latin goes for crab. Now Galen, who is another Greek physician, used the term onkos, which actually in Greek means swelling, to describe tumors. Now if you go by the data given by World Health Organization, you will realize that almost 8.2 million people worldwide are dying from cancer. This data is specifically for the year 2012. Now 60% of the world total new annual cases occur mostly in Africa, Asia, Central and South America. Now out of this, 30% are those cancers which are totally preventable. The rest are those which generally is non-preventable, or the stage is a later stage. Now further, if you go by the data given by World Health Organization, all cancers excluding non-melanoma skin cancer, their estimated incidence, if you see mortality and prevalence worldwide, this data is for 2012. Now worldwide, if you see, for men there are around 7,427,000 cases, out of which death is almost 4,653 deaths. Now in women it is around 6,663,000 cases in women, out of which 3,548 is the death rate. Now so consolidated, if you see in the world scenario, the number of cases or the number of people suffering from cancer is around, the cases are almost 14,090,000 cases of cancer, out of which 8,201 are dying. This is 8,201,000, this is all in thousands. Now if you go back to the same data and you see in India, almost if you say both sexes, there are 1015 cases of cancer occurring, while there are deaths are around 683,000 deaths which are taking place in India. This is for a 1 year, that is 2012. Now if you compare the data between India and worldwide, so almost 7% of the world cases are occurring in India itself. So it is a quite high, and almost 8% death, total number of deaths which are taking place in world is accounted for by India itself. Now with this we go forward, we understand how cancer is important, how cancer is killing people, how much rampant this disease is in India itself. Now worldwide, most common form of cancer, if you see, cancer is the leading cause of death. As I just told you, almost 8.2 million deaths had taken place in 2012 itself. Now the most common causes of death or the most common cancers are the lung cancer, due to which almost 1.59 million deaths have taken place in 2012. This is followed by liver, stomach, colorectal, breast, esophageal cancer. So, lung cancer is the predominant type of cancer still in the world at the worst scenario. Now, here you see the cancer cells in liver. As you can see, there are tumors occurring in liver, and if you do a cross sectional section of this liver, you will find the tumor cells histology is much different from the normal cells. Now, this is a slide which shows the lung cancer, how the nodules of cancerous cells are forming in the lung. This is followed by the stomach cancer, the colorectal cancer, and the oral cancer. Almost oral cancer is again becoming a very dreadful, the number of incidents of oral cancer is day by day increasing in India. Now, how exactly tumor formation takes place? Now, the number one process of tumor formation that occurs is like a series of mutations takes place which actually eliminates the restraint which is there on the cell division. Now, you must understand every cell has a normal lifespan in our body. Now, generally there is a programmed cell death for every cell. Now, after a cell has lived its life, for example, a normal span of a red blood cell is 120 days. Now, after that it will have a normal programmed cell death which is called apoptosis. Now, generally during this generation time, during its life, this cell may actually divide, regenerate, divide, proliferate. Now, during this phase, if during this proliferation phase, that is the cell when the cell division is taking place, lots of regulatory mechanisms are there which makes it a proper regulated mechanism of cell division. Now, whenever there is a breakdown of this cell division mechanism, or there is a problem in the regulation of the division of a cell, then the cell the reason behind problem in the cell division could be a mutation taking place in the cell or whatever. Now, whenever there is a problem in the regulation of cell division, it may lead to transformed cell, or the cell undergo division in an unregulated manner. So, going back to the same figure, the very first important point of tumor formation is mutation. That means a series of mutations actually eliminate the restraint on the cell division. A cell has undergone some mutation in its genome which has led to some abnormal protein which finally is having some effect on the cell division. So, the cell division has gone unregulated. Now, the second important problem or the second important phase in this is the tumor growth. Now, the tumor cells lose their organization and they start proliferating quickly. Now, the cell which has undergone mutation or series of mutation is now called a transformed cell. This transformed cell is now rapidly growing into a tumor. Now, tumor cells have lost organization and they are proliferating quickly. Now, as more and more cells are forming, they would require more of blood supply. Now, this blood supply or angiogenesis will be followed by this rapid proliferation. More angiogenesis, that means more and more blood supply is given to the newly proliferated cells. Now, after this would lead to a accumulation or of numerous of the same type of cells at a particular position, which we are calling it as a tumor. Now, this would lead to intravisation. Intravisation means the malignant cells now will spread through the blood vessel and lymphatic vessel into other organs. This process is actually called metastasis, where the malignant cells become established in distant organs, not in the organ, they are moving from the organ where they are produced into some other organ. So, hence the cancer is spreading into the body of an individual. This is how a normal progression of tumor takes place. Now, as you can see, here you have tumor cells. They are having multiple mutations, as you can see. Now, this multiple mutated cells are forming a tumor. This malignant tumor is now spreading through epidermal layer into the blood or the lymph. This is what is taking place. Now, once, as I just told you, once a tumor is forming, there is a primary tumor. Now, this primary tumor, as more and more cells are formed at that area, it will require more blood vessels. So, from 1 to 2, as you will see, there is a progression in the formation of new blood vessels. This process is called angiogenesis. So, almost always whenever there is a lot of proliferation, which is an abnormal proliferation of a cell at a particular place, it will always be followed by angiogenesis, that is blood vessel formation, to supply good amount of blood to the newly formed cells. So, again going back to the slide, as you can see, primary tumor is leading to angiogenesis, and new blood vessels that are formed are now infiltrating into the tumor and reaching to every cell of the tumor, so that they are growing in an uninhibited manner. Now, let us understand what are the molecular events that control progression through the cell cycle. Now, how does cancer relate to the cell cycle? We must know that every cell during its life will have to go through a division process. This division process, or a cell actually undergoes a cycle which is called a cell cycle. Now, if we understand the cell cycle, this is a typical cell cycle where we have phases like G1 phase, S phase, G2 phase and the M phase. Now, if you clearly see, between G1 phase and the S phase, there is a G1 checkpoint. Now, checkpoint is like a regulatory point where certain enzymes are regulating the progression of a cell from the G1 phase into the S phase or the synthetic phase. Generation phase 1 and the generation phase 2 is in between, there is a synthetic phase. Now, from G1 to S phase, this G1 checkpoint, what is it doing? There are certain enzymes which are involved, that is cyclin dependent kinase CDKs. Now, these are very important enzymes which actually are, or factors which are actually regulating the progression of a cell from G1 to S. Now, this checkpoint is very essential. The reason being, if a cell is not fine, it is abnormal, there is some problem in the cell, maybe a mutation has taken place in its genome or whatever is happening, that means the cell is not normal. In a normal situation, this checkpoint should ensure that the cell should not go into the next phase, that is into the synthetic phase. Because if the cell is going into the synthetic phase, then a progression of the cell cycle is taking place, it will get time to get into division phase, it might get divided. So, this is the first checkpoint which is ensuring that a wrongly formed cell or a cell having some error should not actually go from G1 to the S phase. Now, as you go back into this diagram, you will see that between G2 and M phase there is another checkpoint which is called a G2 checkpoint. Now, at G2 checkpoint, again this is another form of regulation wherein the cell is ensuring that an abnormal cell does not go into the mitosis phase. That means it does not go into the M phase. M phase is the phase where actual division is taking place of the cell. All these G1, S and G2 phases are the preparatory phases of a cell. The real division of a cell is taking place in the M phase. So, this another G2 checkpoint is ensuring that a abnormal or erroneous cell having some error inside its genome does not go for further division or into the M phase. Now, within the M phase, there is another checkpoint. So, we have in all 3 checkpoints. The first one is at between the G1 and the S phase. The second is between G2 and the M phase, and within M phase also there is a checkpoint. Now, all these are regulated by certain factors or cyclin dependent kinases or CDKs molecules which ensure that the normal cell only goes into the cell division process. Now, how exactly what happens during a tumor? During a tumor, these checkpoints are obliterated. There is the cyclin dependent kinases or some problem takes place in the checkpoint. So, the regulation is not taking place due to absence of a proper regulation. The abnormal cell actually undergoes a cell division. Now, this cell divisions becomes unregulated as you go further, because already these checkpoints have become obliterated. Now, because of this, the cell will undergo division, more cells will undergo division, and finally it will lead to an unregulated division and leading to a tumor formation. Within a tumor, a cell is undergoing proliferation and there is no programmed cell death. So, technically apoptosis is totally not occurring in the tumor cells. They are becoming, the major important thing is they are undergoing proliferation in an unregulated manner. All these checkpoints are not happening in a tumor cell. Now, let us understand the general events for regulation of cell division in a normal cell. Now, again, in a normal cell, the stimulation of cell division is generally induced by certain growth factors. Now, if you see, if this is a cell, there are certain growth factors which will have their receptors on a normal cell membrane. Now, these growth factors will be given or will be secreted under certain circumstances. For example, when a cell has to undergo a division process, these growth factors will be secreted. Now, these growth factors will come and bind to the receptor on the cell membrane. Now, a signal transduction will take place, a signal will be sent inside the cell. Now, once the signal is sent inside the cell, it will be relayed to the nucleus. Within the nucleus, let us go back to this figure, you will see within the nucleus, this will lead to activation of certain transcription factors and hence transcription of certain genes. Now, the transcribed genes, that means DNA gets converted to RNA within the nucleus. Now, this mRNA which goes out into the cytoplasm will undergo translation into a protein, a normal protein which will stimulate cell division. So, in a normal cell, the cell division is stimulated by a growth factor and hence finally a protein which is favoring the cell division is produced within the cell. Now, there is another method of regulation of cell division in a normal cell, that is inhibition of cell division which is induced by growth inhibiting factor. Now, there are certain growth inhibiting factors which are ensuring that maybe this cell should not undergo division. Now, in that case, there would be a receptor on this cell membrane which is specific for the growth inhibiting factor. So, the growth inhibiting factor will come and bind to the receptor present on this cell. Now, once the growth inhibitor factor has bound, again a signal transduction will take place, the information is relayed to the nucleus. Once it is relayed to the nucleus, it will further activate certain inhibitory mechanisms, so much so the DNA does not get transcribed, it is the transcription does not take place, or the RNA does not get translated into a protein, or in a other situation it causes the production of an mRNA that by transcription which further gets translated into a protein which becomes an inhibitory protein. Either which way, the aim is to inhibit the division of the cell. So, once an inhibitory protein is produced, it will inhibit the cell division cycle, so much so the entire process of cell cycle gets inhibited and the cell does not undergo division. So, naturally, if in a normal cell either the growth factor is promoting the cell division or the growth inhibitory factor is inhibiting the cell division, in an abnormal cell this will undergo a complete reversal. Here either the growth factor is produced which is not produced, or maybe it has undergone the cells which are supposed to produce a growth factor has undergone some mutation, so much so the growth factor is not being produced and hence it is not promoting division, or the inhibitory factor is not being produced and the cell is still going division when it should not. So, in an abnormal cell this normal mechanism is not taking place or it is bypassed. Now, we have four major types of tumors which we are classifying it as carcinomas, sarcomas, hematopoietic cells and organs, or neuroectodermal cells. Now, as we go further, we will define carcinomas as the most frequent transformed epithelial cells lining organ cavities and the surfaces. For example, most of the tumors, almost 80 to 90% tumors which are happening are actually carcinomas. So, they are basically the abnormal proliferation of cells in the epithelial lining. Now, it could be a lung tumor or what we call as lung carcinoma, it could be a colon carcinoma, a breast carcinoma, prostate carcinoma. In these cases, the abnormal division of epithelial cell lining is taking place. Now, in certain cases, certain tumors are called sarcomas, where the mesenchymal tissue like fibroblast, connective tissue kind of tissues are actually getting affected. For example, in case of bone, muscle, etc. So, you have sarcomas or fibroblast, etc., fibroblast sarcoma, etc. Now, in certain cases, the hematopoietic cells or hematopoietic stem cells or the organs which are involved in hematopoiesis are involved. For example, in most of the cases like leukemias, lymphomas, myelomas, the hematopoietic cells and organs are getting affected. Now, there is another category of cells called neuroectodermal cells, wherein the neuroblastomas or glioblastoma or melanomas is taking place. We will deal with all these types of cancers in our next lecture. Thank you very much. Welcome back, viewers. We are dealing with cancer today, a very dreadful disease, and nobody wants to actually hear about cancer, but let us understand what cancer actually is. Now, in our previous lecture, we defined what various types of cancers. We actually deal with all what is happening at the regulatory level in a normal cell and what doesn't occur in an abnormal cell. Now, one must understand a very important aspect of an immune system, that in immune system we have a specialized kind of cells called natural killer cells. Now, generally in an abnormal situation, or if a cell has undergone some mutation, a normal cell has undergone mutation in our body, in a normal immune system, generally these natural killer cells take care of these abnormal cells. So, any cell, any of your self cell which has gone haywire, which has gone something wrong, or it has become abnormal, is generally taken care of by the natural killer cells. That means in a tumor or in a cancer, these NK cells have undergone certain some problem, or something has taken place in NK cell, or something has gone wrong with the immune system where the NK cell is not able to recognize an abnormal cell. So, a lot many things, and many things which do not even know at times, what is happening, how suddenly a person develops cancer. So, in our previous lecture, we actually defined the various types of cancer. Let us understand one more time what are the various types of cancer. So, there are 4 major types of cancers, as you can see. We call them as carcinomas, sarcomas, hematopoietic cells and organ cancer, and neuroectodermal cells cancer. Now, as I have told you in my previous lecture, most of the cancers, almost 80 to 90% of the cancers are actually carcinomas. Now, it is the most frequent transformed epithelial cell lining, or it is affecting the epithelial cell lining, or which is the lining of the organs, cavities and surfaces. For example, the lung carcinoma, colon carcinoma, breast carcinoma, prostate carcinoma, they are the very commonest forms of carcinomas taking place. Now, then we have the sarcomas. Generally, the sarcoma is an abnormal cell growth in a mesenchymal tissue, which could be a fibroblast sarcoma, or maybe occurring in the cartilage or in the bone, muscle, etc. Now, then there is a hematopoietic cell and organs cancer, wherein it is affecting certain hematopoietic organs or cells, like for example, leukemia, lymphomas, myelomas, etc. There is a 4th category of tumor or cancer, which is neuroectodermal cells, which involves the neuroblastomas, glioblastomas, melanomas, etc. Now, let us go further and define these types of cancers once again. As I just told you, carcinoma, as you can see it in the figure, it's affecting the cells that cover the internal and external body surfaces. Now, as I just told you, it could be the surface in the lungs, in the breast, in the colon, in the bladder. These are the most common carcinomas or cancers which are present. Then there are certain cancers which are affecting the blood cells or the hematopoietic cells. We call them as leukemias. Now, then we have certain cancers affecting the lymph nodes, etc. That means there is abnormal cell growth in the lymph node, which we call them as lymphomas. Of course, there are sarcomas where cells in supporting tissues like bones and muscles are getting affected. There is an abnormal growth of cells in these supporting tissues like bones and cartilage. So, these are the various types of cancers that are taking place in human. Now, let us understand the phenotypical property of normal as well as abnormal cell or a cancerous cell. Now, if you are talking about a fibroblast, a normal fibroblast and an abnormal or a cancerous fibroblast in a culture, if we go one by one with the various characteristics, you will see in a normal cell, there is a contact inhibition. Now, after a stipulated growth, after a optimal growth, the normal cell will not go into division because there is a contact inhibition. Now, this contact, that means once a cell has divided into a certain number of cells, it will come into contact with other cells, it will automatically, the further division automatically gets inhibited. Now, this contact inhibition is totally obliterated in case of the cancerous cells. There is no contact inhibition, they keep on dividing without any inhibition due to contact with other cells. Now, the second factor is growth factor requirements. Now, for a normal cell to undergo division, the growth factor requirement is much higher, while for a cancerous cell, the growth factor requirement decreases. So, it does not require that much of growth factor. Once it has started, it just go on dividing on its own. It does not require a high amount of growth factors for further division. Now, if you say encourage dependency, whether they require to anchor to or to log on or to get attached to a surface, it is there in a normal cell. Generally, encourage dependency is high in case of a normal cell, which is again absent in case of a cancerous cell. Now, cell cycle site checkpoints. As I just told you in my previous lectures, there are certain 3 very important checkpoints in a cell cycle. One between the G1 and the M phase, the other between the G2 and the first one between the G1 and the S phase, the second one between the G2 and the M phase, and the third one within the M phase. Now, these checkpoints are intact in a normal cell. So, normal cell will only go into a division if everything is fine. So, these checkpoints are highly important, highly occurring in a normal cell. But in a cancerous cells, there is a compromise at the checkpoint, there is no checkpoint present. So, the cell does not have, even if it is an abnormal cell, it does not have any regulation. The cell is easily going from G1 to the S phase, S to the G2 phase, and finally G to the M phase, and finally dividing unobliterated. It is happening at a rampant level. So, technically the cell cycle checkpoints are not there in a cancerous cell. Now, if you do a karyotypic profiling, generally in a normal cell it will be a normal karyotype. However, in a cancerous cell there could be a mutation taking place, hence the mutation could be in the form of point mutation or a translocation. So, actually you can see what has happened in a karyotype. So, a karyotype in a cancerous cell will show abnormal manifestation, while in a normal cell it will be a normal karyotype. Now, similarly, if you talk about a proliferative lifespan, it is a finite lifespan. If a RBC has to undergo a programmed cell death after 120 days, it will die after 120 days. It is a programmed cell, it is already programmed in a cell. So, there is a finite lifespan of a normal cell, which is infinite in case of a abnormal cell or a cancerous cell. So, based on all these parameters, we can actually differentiate between a normal cell and a cancerous cell. Furthermore, if you go by the growth properties of a normal cell and an abnormal cell, you can see in a normal cell, in a culture, generally the normal cells will grow in a monolayer, partly because they get contact inhibition or they also need anchorage. Now, in an abnormal cell, if you see in a cancerous cell, they can grow in clumps because there is no contact inhibition in case of a cancerous cell. They do not get this division, do not get inhibited because of contact with other growing cells, other proliferative cells. So, they are actually forming a lump in a culture medium. So, and which can easily be seen if under the microscope also. Now, let us understand at a genetic level what is causing a normal cell to become a cancerous cell. So, 4 classes of genes actually undergo mutation in cancer. That means these genes, if they do not undergo mutation, if they are normal, the cell will have a normal division. However, due to some mutation can be a point mutation, mutation can be a duplication, mutation can be a translocation, any kind of mutation that is taking place in these 4 types of genes will actually transform a cell into a transformed cell or a cancerous cell or finally into a tumor. So, let us understand what are the 4 types of genes which are very important, which may undergo mutation in a cancerous cell. The first gene is called a proto-oncogene. Now, proto-oncogene are those genes whose products normally control how often a cell divides and to the degree to which it differentiates. However, if this gene undergoes a mutation, as I just told you, any type of mutation, point mutation, duplication or translocation, any type of mutation taking place in proto-oncogene can convert it into an oncogene. This oncogene, if it gets activated, will cause the cell to go into uninhibited proliferation. The second type of gene which is very important is a tumor suppressive gene or a tumor suppressor gene. Now, generally if a tumor suppressor gene is intact, it is not gone any problem, it has not gone any mutation or anything, generally it inhibits proliferation of cells. Now, naturally if it has undergone some mutation and is leading to an abnormal protein product, it will cause uninhibited proliferation of the cells. So, technically the tumor suppressor genes are those genes which are inhibiting uninhibited proliferation of cells. Any mutation in them will cause cancer formation. The third type of gene which is present, which is important for a normal development, is a microRNA or miRNA genes. Now, mostly these genes cause interference. Now, they produce certain small RNA that silence the expression of other genes. Now, unfortunately, if there is a mutation in these interference genes, miRNA, then it will not produce certain small RNA which actually silence the expression of other genes, and hence once these small RNAs are not produced, it will again cause formation of cancer. There is another category which is called the mutator genes, whose product actually ensures accurate replication and maintenance of the genome. Naturally, when this gene is mutated, the replication is compromised and the genome is not hence maintained properly, which leads to an abnormal situation. Now, let us understand how cancer actually takes place. Now, cancer may not be just because of one mutation, it could be because of many mutations. It may be mutation in the same gene or it could be mutation in number of genes. So, it could be a one-step phenomena, but generally it is found that cancer or formation of tumor is a multi-step process. Now, as you can see in this slide is about adenomatous polyposis, which is a colorectal cancer. There are 3 major genes which are tumor suppressor genes called APC, DCC and P53 gene, which are present, which actually have undergone mutation to cause this situation of colorectal cancer. Another oncogene which is responsible is a RAS gene. So, it is this phenomena or this transformation or this cancer is a culmination of mutation in 4 different genes which are leading to a cancer. Now, again let us go back to this slide. As you can see, there is a normal colon cell. It leads to it because of certain mutation, it causes the loss of the APC gene. Once the APC gene has undergone loss, it causes increased cell growth. With increased cell growth, there is DNA hypomethylation, which causes adenoma class 1. Now, furthermore, there is a gene mutation in the RAS gene. Once the RAS gene undergoes mutation, we have adenoma class 2 type of cancer. This is followed by gene loss, DCC gene loss, which causes adenoma class 3. Now, after that, if P53 gene loss, P53 actually is a suppressor gene which is present in all cells. It causes suppression of tumor. Now, unfortunately, if P53 gene loss takes place, it will lead to carcinoma formation. Now, furthermore, there could be many other gene losses as well, which actually could lead to metastasis. So, initially an adenomatous polyposis, which is a colorectal cancer, which is because of mutation in various types of genes means like APC, TCC, P53, RAS, they all are undergoing mutation, which finally is forming a carcinoma or a colorectal cancer. Now, once this carcinoma is formed, it can actually metastasize. Once it undergoes metastasis, it will move to other organs and will finally invade various organs of the body, and a situation which becomes very difficult, from where the person generally it becomes a no return kind of a situation. Now, what exactly is oncogenesis? Let us understand. Oncogenesis is mainly caused by the action of certain genes which are introduced by tumor viruses. So, the first reason why generally the cancer takes place, we described the various types of genes which have undergone mutation. We also said that it could be a unistep or it could be a multi-step process of cancer formation due to mutation in various genes. Now, oncogenesis could also take place because of certain tumor viruses. Now, these tumor viruses may be introduced because of infection. Now, generally in a normal individual, these tumor viruses will be taken care of by the immune system. However, because of some reason, if these tumor viruses wins the fight if there is a fight between the tumor viruses and the immune system, and if tumor viruses come out winner, then what happens? Then tumorigenesis takes place. Then there is a genetic changes such as gene or chromosome mutation, wherein the proto-oncogenes or tumor suppressor genes undergo certain mutations because of the coming in of the tumor viruses. Now, there could also be an exposure to mutagens or radiation. So, these all are the causative agents of oncogenesis. Oncogenesis, production of tumor. Now, the tumor may be produced because of certain tumor viruses. The tumor may be produced due to mutation in the proto-oncogenes or in the tumor suppressor genes. The tumor may be because of certain mutagens or due to radiation. Now, as you can see in this slide, there is a mammogram showing a tumor, and this mammogram shows exactly there is a nodule formation, there is a breast tissue where you can clearly see a tumor formation. Now, in 1966, the discovery of tumor inducing viruses, that is Ross sarcoma virus, was done by Ross. Now, in the Nobel Prize in Physiology or Medicine was given in 1966 to Peyton Ross for his discovery of tumor inducing virus. The tumor inducing virus in this case was Ross sarcoma virus, which he found in the chicken. Now, later Charles Brenton Huggins also discovered certain hormonal treatment of prostatic cancer. Together they were given Nobel Prize in Physiology or Medicine in 1966. However, this Ross sarcoma virus was actually found in the earlier half of this 20th century, but the Nobel Prize was actually given in 1966. Now, initially what happened, he took the tissue from the chicken which was actually said to be infected by the Ross sarcoma virus, the sarcoma virus. Now, once he lysed the tissue, went through the centrifugation, took the filtrate and again used this filtrate on another chicken, he found that the other chickens were also getting this sarcoma, they were getting affected. So, he realized that there is something in the filtrate which is causing the transformation of this normal tissue in a normal chicken into a sarcoma. So, that factor was actually found to be a virus, hence the virus was called Ross sarcoma virus or RSV. Now, let us see some transducing retroviruses and their viral oncogenes. Now, some oncogene like SRC, which is actually causative agent of present in the Rous sarcoma virus, its origin, as I just told you, was in the chicken, and the type of cancer which it was causing was sarcoma. So, you can see a lot many other transducing retroviruses and their viral oncogenes. For example, MIC, the retrovirus isolate is MC29 and its origin was again in chicken, and it is causing sarcoma, carcinoma, myelocytoma, etc. Similarly, you have RAF, which is the retrovirus isolate is 3611 MSV. The origin is from the mouse and it is again causing sarcoma. So, this is a list of all those oncogenes which are causing various types of cancers. It could be sarcoma, it could be leukemia, it could be osteosarcoma, it could be myeloblastosis and so on. Now, what happens when we have mutation in the proto-oncogene? Now, as you can see here, proto-oncogene is actually that gene which is normally regulating the cell division. They are the right kind of genes. Now, proto-oncogene, once they undergo mutation, they will get changed into oncogene. Oncogene is the real causative agent of a cancer. For example, as you can see here, the proto-oncogene has, there are two alleles for any gene which is present. This proto-oncogene, which is causing normal growth control, now it has undergone mutation to cause oncogene production. This actually leads to loss of the function of that particular protein because of the presence of that particular mutation, and hence due to abnormal protein production, the cell will become tumorigenic. Now, what are the classes of various proto-oncogene products? As you can see, certain growth factors, for example, cis, which is the PDGF B chain growth factor, or INT2, which is the FGF related growth factor. Similarly, you have various proto-oncogenes which are the receptors and non-receptors of protein tyrosine and protein serine tyrosine kinases like SRC, etc. Now, this is a list of various proto-oncogenes which are involved in normal cell divisions of a cell. Any abnormality, any mutation in any of these proto-oncogenes which lead to an abnormal product, these are the products of the proto-oncogene. So, any abnormal product would further cause the formation of a tumor. Now, let us understand the mutation in tumor suppressor genes. As I just told you, there are certain tumor suppressor genes which are present in a normal cell. The function of these tumor suppressor genes is inhibitory in nature. That means they actually inhibit the cell division, abnormal cell division. Now, if these tumor suppressor genes are present, the cell will normally divide, and if the signals are not right, if it is not, the cell has undergone some abnormality, the tumor suppressor gene will ensure that the cell does not undergo cell division. Naturally so, if this tumor suppressor gene has undergone some mutation, it will lead to an abnormal gene product. Now, let us see, there are tumor suppressor gene mutations. Now, again, as it is a gene, it will have two alleles on two chromosomes, homozygous chromosomes. The tumor suppressor gene will cause normal growth control. Now, however, if it has undergone mutation on one allele, the mutated tumor suppressor gene will again cause a normal growth control. However, unfortunately, if both tumor suppressor genes have undergone mutation, it will cause loss of the growth control factor, and hence the growth will not become regulated and it will undergo unregulated growth control and hence formation of tumor. So, any mutation in tumor suppressor genes, specifically if both the alleles are getting affected, will cause tumor formation. Now, as again we are seeing, in a tumor suppressor gene, a normal suppressor gene will produce normal growth inhibiting protein, which further cause a normal or a regulated cell division, that is a controlled cell division. However, a mutated tumor suppressor gene, as you can see in the figure, will produce a defective non-functioning protein. This defective non-functioning protein will lead to abnormal cell division or uncontrolled cell division and hence tumor formation. Now, some of the tumor suppressor gene, as you can see, have been enlisted here. These genes are APC, ARF, BRCA1, E-cadherin, INK4A, NF1, etc. Now, as you can see, APC is a gene which is a tumor suppressor gene, and any abnormality in this gene or any mutation in this gene will cause colorectal tumor formation. Its function actually is to bind beta catenin, which act as a transcription factor. Generally the inherited syndrome in this case is called familial adenomatous polyposis. We will discuss this in detail a little later. Now BRCA1 is another tumor suppressor gene which causes the primary tumor formation in case of breast, and its main function is the DNA repair. So naturally if a normal BRCA1 is present, it will ensure that if there is an abnormal DNA or there is a DNA where there is a problem in the DNA or in the genome sequence, it will lead to repair of the DNA. But unfortunately if BRCA1 has undergone mutation, this DNA repair will not take place and will eventually lead to breast cancer formation. Generally the inherited syndrome is called familial breast cancer. So we have a list of these tumor suppressor genes which are actually having a inherited syndrome as well. Now is all genes, what are the main important tumor suppressor genes? The most important tumor suppressor gene which is present in our each and every cell is called P53, which was also called a housekeeping genes, which was also given a gene of the year in way back in the maybe in the last decade. Now what actually P53 does? P53 gene is present in our genome. It causes the production of P53 protein product. Now this P53 protein product actually binds to a promoter of a VAF1 gene and will produce a protein product. Now VAF1 actually codes for P21 gene. Now P21 actually binds to the cyclin CDK and because one cyclin CDK binds to P21 protein, there would be no kinase activity, and absence of kinase actually blocks transition to the S. That means the checkpoint between G1 and S phase is regulated by the P53 gene. If P53 is normal, it will cause production of a normal P21 gene. A normal P21 will bind to CDK, cyclin CDK, and will cause a regulation between the G1 and the S phase of the cell cycle, and maybe the cell will not progress further. Now because of a defect in the P53, any mutation in the P53, you will find this entire process get obliterated. The checkpoint is no longer there. The cell easily progresses from G1 to S phase, and hence unregulated cell growth is taking place due to a mutation in the P53 gene. Almost 50% of the human cancers are found to have a mutation in the P53 suppressor gene. So you can understand how important P53 gene is. Any mutation in P53 is going to have a dire consequences. Now further to understand tumor suppressor gene, let us go to the retinoblastoma gene, that is RB gene. Now retinoblastoma, as you can see in the figure, is a childhood cancer of the eye. In retinoblastoma, which develops during the period from birth to age 4 and is the most common eye tumor in case of children. As you can see, the inheritance pattern in case of retinoblastoma, you will see this is called a Knutson's 2-hit mutation model. Now the retinoblastoma can manifest as a sporadic retinoblastoma or a hereditary retinoblastoma. As you can see in the B part, I am showing the hereditary retinoblastoma. In this case, the child has actually inherited one defected retinoblastoma for either of the parents. Now this retinoblastoma, as I just told you, every gene will have 2 alleles. So if the child has inherited one defective retinoblastoma, now what will happen? It will have a normal cell growth. But during the development, a second mutation is followed, so much so the retinoblastoma, the other non-defective gene, also becomes defective, and hence it leads to loss of the growth control, and in most of the cases both the eye gets person loses or the tumor develops in both the eyes. In another case, which is called a sporadic retinoblastoma, here what happens, the 2 mutation in both the alleles of the retinoblastoma is taking place later. The child has inherited non-defective retinoblastoma genes from both the parents, but later because of 2 mutations that take place, the retinoblastoma, both the alleles of retinoblastoma has become defective because of the mutation in them, and hence it is leading to formation of tumor in the retina. However, the sporadic, the chances of having two mutation is much rare. Hence, sporadic retinoblastoma occurrence is much lesser than the hereditary retinoblastoma. Now, let us understand the modifying and avoiding risk factors. More than 30% of cancer deaths could be prevented by modifying or avoiding key risk factors, which include tobacco smoking or tobacco intake, overweight, obese, unhealthy diet with low fruit and vegetable intake, lack of physical activity, alcohol consumption, or STDs, that is sexually transmitted diseases which involves human papilloma virus infection, or hepatitis B virus, urban air pollution, indoor smoke from household use of solid fuels, all are the causes of cancer these days. Now, the treatment of cancer actually involves a right diagnosis. The first critical step in the management of cancer is to establish the diagnosis based on pathological examination. A range of tests is essential to determine the spread of the tumor. The major treatment modalities involves a careful selection of one or more of the major treatment like surgery, radiotherapy, or systemic therapy. Systemic therapy involves a selection that should be based on evidence of the best existing treatment which is given the resources available. So, based on that one can make a treatment schedule. Now, cancer diagnosis is generally done by PET scan or CT scan. The PET, which is generally a short form of positron emission tomography scan or a computed tomography scan, is generally used to detect and determine the stage of the cancer or to determine metastasis or to evaluate the effectiveness of the cancer treatments. Now, cancer diagnosis, this is one of the PET scan which I am showing it to you. As you can see, this with use of this PET scan will be able to establish how much of the cancer progression has taken place in a particular individual. Now, the cancer treatments, there are lots of cancer treatments, but it also generally have a lot of side effects. The major cancer treatments involve surgery, radiation therapy, chemotherapy, or hormone therapies. They can be used alone or in combination as well. Now, these therapies, for example, tumor surgery, it involves the removal of the cancerous tissue, and it can be a local treatment also and can be used for diagnosis, staging, relief of side effects, or to just ease the pain. Now, cancer treatments can have a lot of side effects also. Now, as you can see, there are radiation therapies also involved, which involves X-rays to kill cancer cells. The X-rays can be localized X-ray, which can be given externally or internally. Now, this can be given on a daily basis, radiation therapy, or on a sporadic basis depending upon the progression of the cancer. Now, most of the side effects which are involved in radiation therapy are skin irritation, hair loss, digestive problems, fatigue, urinary and bladder problems, sexual fertility problems, bleeding, infection. These are the various types of side effects that generally follows after radiation therapy. The major side effects involved is called alopecia, which is hair loss, which only happens on the part of the body that is being treated, and mostly the hair grows back after 3 to 6 months of a treatment. Chemotherapy involves drug use, which could be fluorouracil, doxorubicin, paclitaxel. Systemic treatment involves damages healthy cells along with cancer cells, or it could be given orally, IV, or by injection into various sites. Now, major side effect of chemotherapy are myelosuppression, which is suppression of the bone marrow, new cells are not formed. There is neutropenia, that is low number of WBCs, anemia, low number of RBCs, thrombocytopenia, the platelet count goes down, gastrointestinal problem like nausea, vomiting, diarrhea, etc., appetite loss, fatigue, etc. Hormonal therapy is generally given to slow down the growth of breast, prostate cancer, and is generally given for 5 to 10 years. Now, this slide shows that there are around 1,86,550 number of lives that could be easily saved each year if we eat healthy diet and exercise regularly. The number of lives, these are the number of lives that could be easily saved each year with no tobacco. This is from American Cancer Society. With this, I come to the end of my lecture. Thank you very much.
Thank you, ma'am. Thank you so very much for giving us a precious session, and we believe that this lecture appears to be very, very beneficial for the students. So, dear friends, if you have any queries or suggestions, then you can mail us at info.cc@nic.in. We would be meeting again soon. Till then, take care. Goodbye.